Welcome back. I'm joined now by Lucy Douglas from New Beginnings Wellness Center and Spa in Ruston. Lucy, last week we talked about cholesterol. Today we are going to talk about diabetes and diabetes screening.
Yes, it's one of my very favorite things to talk about. And particularly I want to talk about prediabetes today. And I know I'm kind of being a bit redundant of something I touched on a couple of weeks ago when I spoke about the blood test, the hemoglobin A1C. And that's a test commonly used in primary care, even on people that are not diabetics. And so that's why I want to touch on it, because I want people to be aware that it's something they need to ask for, and they need to kind of have a handle on, perhaps am I someone at risk? And it's surprising to me in practice, the people that I see that do have elevated blood sugar that you would not be able to necessarily pick and say they look like that profile that we automatically think just because someone perhaps may be overweight or obese, then that means that they are surely in that category. But I see people all the time that are thin. I've seen kids with elevated blood sugar. So it's really important that we test that. The statistics are very alarming when you look at certainly the number in this country of people with type 2 diabetes, but then when you have that other category of prediabetes and then this other sort of mystical category where the American Diabetes Association, the CDC, they say there also is this population walking around out there that are undiagnosed. And that is really alarming to me, because that, like you and I just talked about, that's something that's very preventable.
Right. So
it's just a matter of that lifestyle and making the right choices on a daily basis to protect yourself. The American Diabetes Association says a fasting blood sugar greater than 125 is where we classify type 2 diabetes. But then you have this in between of 101 to 125 that is classified as prediabetes.
Right. How does somebody what are the warning signs? I may be diabetic. I may have. What if somebody wants to get screened for this? What kind of things should they be looking for symptom-wise?
Well, I say it needs to be part of everybody's wellness screening. You know, just when we go, hopefully people go to the doctor every year and have, you know, just that screening panel of blood work and a good checkup.
Before they even have a symptom.
Before they even have a symptom. But anybody that's older than 45 and overweight needs to be screened. This is very interesting to me. Women that had babies that weighed greater than 9 pounds are considered at risk for diabetes. Certainly anyone of darker skin, African American, Latino, Pacific Island, those types of ethnicities have been looked at in research and have been determined to be at greater risk for that type of disease process. So, but certainly I've had several patients present to me just profound fatigue, thirst, increased urination. Those are pretty classic of type 2 diabetes. But I'm speaking about this section of prediabetes that we can pick up many years before it turns into a problem to prevent then those complications associated with overt type 2 diabetes.
Okay, well, Lucy, we are out of time. Thank you so much for being here today. Always check with your doctor, be screened for diabetes. You know, even if you don't have the symptoms, get screened. It's very important. Stay with us. We'll be back.